On this episode of Africa Health Check,
I think the government should give priority to the healthcare issue and use the taxpayers' money properly and wisely.
The role they should play is to provide more centers for these medications.
we shed light on the efforts made by governments, organizations, and international bodies to achieve universal health coverage.
We also work with those parents who don't have children's abilities, but they have an interest, they have a heart.
And improve health outcomes on the African continent. Access to quality healthcare is a fundamental human right. Yet many regions in Africa face significant challenges in providing comprehensive and affordable health services to their populations. On today's episode, we will be discussing expanding access to healthcare for all. My name is Khokhontlejang Paladimorokoto and I am your host, welcoming you to Africa Health Check. I am joined by our experts, Dr. Marianne Moreithi, the chair in the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who is a pharmacist and a pastor from Ghana. But before we hear from our experts, let us have a look at this episode's feature story.
I am a parent who has a child with a disability. My second born son is the one who has a disability, and the type of disability is deaf. So I've lived with my son for the past 24 years. I work for Zambia Association of Parents for Children with Disabilities, ZAPCD, as a national coordinator. And my role in this organization is to coordinate the programs that we do as an organization, working with the parents who have children with disabilities. But we don't only work with the parents who have children with disabilities, we also work with those parents who don't have children with disabilities, but they have an interest, they have a heart to work for children with disabilities and advocate for their rights. What motivated me, or how I found myself in this association, I had my second born child in the year 1999. He was just born okay. And then at the age of 3 months, that's when he suffered from meningitis. So when he suffered from meningitis, I think we stayed in UTH for almost a month, and we were discharged. Then upon being discharged, I think I wasn't advised on the side effects of meningitis. So I would just take him for reviews at UTH every month. But when he reached the age of 8 months, I think that's when we noticed that there were some developmental delays in his growing. Like he was not sitting, he was not crawling, like he could just be sleeping. There was an organization called Action on Disability and Development, UK-based organization. And they had an interest to work with the parents, and they encouraged us to form an association. So that's how come ZAPCD was formed in the year 2001. Before my child had a disability, I was a preschool teacher, and I was just like in a different field. But after having a child with a disability, I think I developed an interest on how we are going to help our children living with disabilities in Zambia, because I have seen a lot of parents who live like hopeless lives after having a child with a disability. But as an organization, we are there to say we are giving hope. Even if you have a child with a disability, your parents who have children with disabilities, there is life after having that child with a disability. My son now, he is 24 years. He is deaf, and I made sure that I educated him. He is now in college. He's doing his second year in teaching mathematics and sign language, secondary mathematics and sign language. He's at Zambia Institute of Special Education, ZAMISE. So I think I'm a proud mother because I've seen my child with a disability who is deaf, and he's doing so well in his academic work. like mathematics, it's very difficult, like for people to pass in mathematics, especially using sign language, but he has managed to pass that subject, and that's the subject that he's going to be teaching to other children with disabilities. We've done the trainings on youths with disabilities, and we've seen our youths who have grown, our children who have grown. By the time we are starting the organizations, they were babies, but now they are managing. We have one by the name of Ian Banda. He's now managing an organization called Yadiz that is being managed by the youths with disabilities. He is the leader of that organization. We have groomed that child, and now he is managing an organization on his own with his fellow youths.
What a very, very passionate mother, and I must say that your son is definitely very, very blessed to have you as a mother and being an activist and making sure that despite his disability is able to realize his full potential. However, not a lot of people have such a privilege to have such a parent going an extra mile, and we should be creating an environment where those children who do not have a support system like she is supporting her son should also be able to access health services equitably, just like anybody in our society. So, Reverend, when we're talking about populations that are still not accessing healthcare services, who are those people? Who are those members of our communities that we're still greatly disadvantaging from having equitable access to healthcare services?
The idea of expanding healthcare to everybody is that nobody is being left out.
Yes.
Poor, rich, in the cities, in the villages, across the board. And what this mother is doing is phenomenal. And it's an example of a commitment and a belief that if I can do something about this condition, all is not lost.
Yes.
And that is a great success story that can be multiplied in other communities as well.
Absolutely. Maybe just to add on to that, we're talking about populations, key populations that we are still denying them access to their human right, which is equitable access to healthcare services. Can you just mention some of those populations that are still being deprived of enjoying this human right?
Yes, and that makes me quite sad that there are people within our communities that are feeling left out in this very important basic human rights providence. For me, I'm passionate about women, young women and young girls, and I feel this our key population that most of the time they're left out. And I'm trying to imagine some of where are they being left out in some of this decision making, in some of the providence of healthcare. And these are women or young girls in remote areas. They are not on the decision making table. They are not in the political seats. They are not the leaders. There are cultural barriers that affect them. They do not even have autonomy to make decisions about their own body because someone else is making that decision for them. So I feel this is a key population, a very vulnerable population that needs to be protected. We need to have laws and policies that gives them equal rights to access healthcare when they need it and when they want it, not when someone else makes that decision for them. So for me, I feel we really we need to strengthen our healthcare systems to make sure we are reaching our young girls and women.
Absolutely, absolutely. I totally agree with you on that. And maybe perhaps since we're discussing expanding access to healthcare services, you could touch on what are some of the key or crucial healthcare services that a lot of people, a lot of women, people with disabilities, people in rural areas still do not have equitable or affordable or even access to those services generally.
Yes, that's an interesting question. 2-3 days ago, a medical doctor called me, one of my students, and he was posted to a rural facility in Kenya. And he's very passionate about medicine, helping his communities. But he told me, Dr. Marianne, I'm so frustrated. We have patients, we have mothers, women coming in, but I don't have the equipment to save their lives. Marianne, I don't have the drugs. the drugs, simple drugs to help me treat this woman or treat this baby. And I'm so frustrated. So for me, and we had a very good conversation with him, and I feel we need, yes, we have the dispensary, we have the hospital, maybe that's close by, we have the mobile clinic that would drive all the way to that woman, but is it equipped? And if it's equipped, we have trained personnel to use those equipment? Or do you have trained personnel to dispense those drugs in the way they should be dispensed? So I feel, yes, we are getting there, but we need to really strengthen by making sure we have enough personnel, we have enough equipment, we have enough facilities. And how do we do that? Maybe we need to now have a conversation with donors, with non-governmental organizations. Maybe we need to talk about national health insurance that makes sure that this hospital is well equipped, this hospital has enough medicine, so that that doctor doesn't call me out of frustration. Because in fact, the call was about, I want to transfer to a private hospital that has all these things at the tip of my finger because I want to practice medicine and practice it well.
Absolutely. You know, when talking about some of the services that are not accessible or reaching people, you know, I know that in my country, one of the key services or health services that a lot of people don't have access to, and talking of shortage of communities, is sexual reproductive health commodities. Many clinics, and not just in the rural areas, because sometimes we think these capacity gaps, the lack of commodities is only in rural, remote areas. But even sometimes clinics in the city, in the big towns and in urban areas, you go there, you don't find contraceptives, condoms, emergency contraceptive pill, you don't find a painkiller, you know. Sometimes I remember in my country, people in the street like to say that the only thing that you will find in a clinic is just a bandage, you know. So the facility is there, the human resources there, but the actual commodities are not there. And this is, I think, one of the key drivers of the prevalence of sexually transmitted infections, because somebody goes to the clinic, they don't find what they're looking for, and then they just go back home. So maybe just to loop you in, you can share Ghana experience. What are some of the key health services that people do not have access to generally?
It's across the board. You can be in Accra and still lack certain services, certain personnel. So to me, one of the keys, you know, to this issue is let us look at the doctor-patient ratio, the healthcare workers and patients ratio, wherever they are, and then scale up, you know, how to call it, invest in their training and their specialization and ongoing training, because if there are many available, then people can access them all over the place, plus facilities and equipment, like Dr. Mariam is alluding to shortly. Without that, there is nothing we can do. So then opinion leaders, government leaders, how to call it, NGOs must all come in this area to train people, personnel all the time, increase their number, plus facilities across, not just in the urban centers, but across. So it's easily accessible. You know, without that, we can't, you know, achieve this
Absolutely.
This goal.
So at Africa Health Check, we're in the business of also conducting public health education.
Yes.
So let us use this opportunity to maybe share one of the key benefits of ensuring that we expand access to healthcare for all and leaving no one behind, Dr. Mary Ann. And feel free to give examples of where this is, you know, a country in Africa or anywhere where this is being done very, very well.
Yes, so it's very important to be able to expand access to all, men, women, children, the most vulnerable, our refugees. You know, we sometimes leave them out. And in Kenya, for example, we have the largest refugee camp, I think, in the world. That is the Kakuma refugee camp. So how are we making sure that they can access good health care? And for me, I would give an example. In Kenya, we have what we call a Beyond Zero campaign, where our First Lady, our former First Lady, had this huge campaign or initiative where she had imagined that we can have mobile clinics that can drive all the way to the remotest parts of Kenya and meet the people at their point of needs. In the northern part of Kenya, we have nomads. They move around with their animals, with their camels, looking for pastures. When will that woman ever access good health care? So the idea here was to go to her, meet her at a point of need, then make sure these mobile clinics are well-funded, well-equipped, they have the personnel that they need, and that initiative has brought such a unique change in our country. Another important way to increase and expand accessible healthcare is to make sure it's affordable. And we need to make it affordable. We need a national insurance. And for example, in Kenya, we have what we call National Health Insurance Fund, where we all contribute to it, if you're working or not. If you're working and earning a certain amount, you actually pay more. Ghana, I know, also has the same. South Africa, I know, in their parliament, they had a bit of a squabble on how to implement this national fund. So this conversation is gaining momentum in Africa. And it's fantastic that we're all talking about a national health fund. So meaning that we're all contributing to the health care of our country, of our communities, so that we can then protect our mothers, protect our girls. In Kenya, we have what we call Linda Mama Initiative, meaning protect our mothers. And in this, we're using bits of the funds from the National Health Fund, a bit of funds from the government and donors to equip our hospitals to have the equipment for safe delivery, to have the equipment to make sure a mother and a baby survive the childbirth, to make sure that we have trained personnel already at that hospital to help the mother in case she has any complications. That initiative has saved lives in our country. And we are hoping that it can expand more so that it can reach the most remotest area. This woman does not need to have money to come to Nairobi to the biggest hospital because her local hospital is well equipped.
Sufficient, absolutely. Maybe tying into that very briefly, Reverend, looking at leadership in Africa, because there's a huge component of governance to all of these commitments, these targets that we have. Do you think generally we have competent leadership in the health sector to deliver on universal health coverage targets?
I believe there are, but there are so many other issues, so many other problems that are competing, with this subject. But to me, it's a priority. What does health mean to a growing or developing nation? What does health mean to the economy of a nation? Then once we are able to define that a healthy nation is a prosperous, it's a wealthy nation, then we take that into policy making, and then we take that into funding. We take that into making it work. Raise the healthcare workers, raise facilities, take the message to them, and through the awareness, through communication, the people are also able to understand. So the two merge, and the solution comes.
Yeah, and that's where impact will come from. I want us to go for a break, but when we come back, I want us to discuss a little bit about the role of technology and innovation in accelerating this agenda of expanding access to health for all and leaving no one behind. But for now, we're going for a quick break. We will hear what people on the streets of Africa had to say, so do stay tuned.
I love that we're touching on the psychological and mental issues that this really, the pandemic touched on. I myself am someone who enjoys the indoors. So at the risk of sounding blasé, I enjoyed my lockdown days. However, the quiet does push you to live in your own head a lot. And even for someone who enjoys being in the house, it does open the doors to anxiety, to depression, not knowing how you're going to make up for time lost since the months were ticking by.
They used to subsidize drugs. Seriously, it's not a health center. Okay, look at now. The other time I had the issue umbilical hernia for my child, which nearly cost her life. I'm saying Apo, I have to drive from Apo to Asokoro Hospital. You know how many miles just for my child to have a medication? Is it fair? a country as rich as Nigeria. So I'm pleading our government, they need to do a subsidy in health center, in health sector.
For the villagers, I think they should be taught how to keep sanitation, keeping themselves clean. Obviously, they don't use proper toilets. They use pits, latrines. So they need to be taught how to wash their hands after the toilet. They need to know how to, because some of them are carrying babies on their backs. So that can also affect children. They are from using the toilet, then they touch the children. That can bring cholera and other infections.
Welcome back. You're still watching Africa Health Check, and today we are discussing expanding access to healthcare services for all and leaving no one behind. I'm going to come back to you, Reverend. Just before the break, we're talking about the governance and sort of administrative side. And now I want you, to sort of take it a step further, and we're talking about what is the way forward. What do you think could be the role or the use of innovation and technology in ensuring that we expand our reach and equitable access to healthcare services for everyone?
Yes. I believe that when COVID-19 hit the nations, it became necessary for people to adapt to what we call the new normal.
Yes.
That is virtual meetings on Zoom, instead of going to sit in the classrooms, social media. So I think we can explore or exploit these same technologies to decode and communicate where people can find access or access health facilities and services in various places on social media. And the use of artificial intelligence, in these areas. They have helped in other situations, so why not in healthcare?
Exactly, yes. I think the use of artificial intelligence, drone technology, surveillance, and all of that. I think these are some of the innovative aspects that we still have not really tapped into in Africa generally. I know we talk about these things, but we still haven't really invested a lot of time in research and development, and even resources in terms of developing prototypes and rolling out this kind of technology. So, we've been talking a lot about UHC, the targets, what are the indicators. I want you, Dr. Marianne, because I know you're well traveled and you've done a lot of benchmarking exercises, perhaps share with us some of the countries, whether in Africa or outside Africa, that have actually successfully achieved UHC and how that looks like.
Wow, so that's an interesting question because each country has its own model.
Yes.
We could start off maybe one of the countries with best healthcare systems.
Yes.
We have Canada, we have Australia, we have Norway, we have the Netherlands, where it's easy to access healthcare. The hospitals are well equipped, their personnel are well equipped, they're utilizing AI, they're utilizing telemedicine, they're utilizing home care services. A mother doesn't even need to go to a hospital because the hospital will come to, how amazing is that?
Services at your fingertips, literally.
Exactly. I have friends at school based in the UK. They had their baby. Yes, the baby will be had at home in the hospital setting. But on day 2, they're told to go home, and each day they
follow up.
Healthcare worker who looks at the baby, looks at the mom. The healthcare worker is trained to even spot postnatal depression, which is again something we don't really talk about or normalize here. And they get that excellent care and follow up. So I'd want to have something like that here at home. And I know we're going to achieve that. With again working together, collaborations, working together with our governments, strengthening our healthcare workers. Where I would really love to have a healthcare worker come home and ask me maybe after I've delivered, how am I doing? Am I breastfeeding okay? Is my child feeding okay? That's a dream. So such countries have such measures, and it's equitable care for each and every person. And this is what we envision also in Africa.
Yes, and for us to attain that, Dr. Marian, who do you think are the major stakeholders? Who are the key stakeholders? What do they need to do in order to ensure that we realize those targets? You know, we are actually lagging behind. We're just 7 years away from the 2030 UHC targets. I know that COVID-19 probably set us back because of competing priorities and a shift in our healthcare systems and budget and all of that, you know, but when we're talking about accelerating access to healthcare services for all, who are the key drivers of that? Who are the key stakeholders to lead on delivering that target?
Yeah, so for me to be quite widespread, I would say we all have a role to play.
Yes.
Because I'd want to say, oh yeah, the government, why is the government not doing enough? But I feel we all have a role to play to make sure that we can achieve that universal healthcare coverage, right from the government. What policies are there to make sure that our hospitals are funded? What policies are there to make sure that supply chain, that we're not lacking medicine? You could have the hospitals, yes. You could have trained personnel, but are there equipments? Are there medication?
Yes.
Are there gloves? Are there syringes? So having the supply chain working, enough policies also working, and policies should be regulated. Simple laws to make sure that the woman in Kajiado, somewhere in a remote area, is able to access this care without having to travel or without having to spend her money. So again, coming down to the communities, would want to make sure that there's education, there's awareness, that we have that autonomy to say, I'm not feeling very well. Let me myself go and look for a doctor, a nurse, or a healthcare provider. I don't need to seek permission. To do that, we need to break some cultural norms and break some cultural barriers. So again, comes down to the community gatekeepers, to the local chiefs, the local midwives. So in a nutshell, we all have a role to play, maybe different roles to play. But I feel if we all work together, enough policies, enough laws for our legislators, and again down to the villages, we have enough infrastructure. I think we can achieve that universal healthcare coverage.
Yes. You know, during the COVID, I know many nations, you know, created COVID fund, to which many people, private sector donors donated or gave extensively, massively to the COVID fund, from which the governments, you know, took care of so many other things. The NHIF, NHIS, to which every worker, you know, contributes. I think if our people come to understand that it's our collective responsibility, let us give towards that. And if the government will prioritize that, I think people would support this worthy cause.
And you know what? As much as we want to contribute to the fund, I really want to do that. I feel also our governments should safeguard my contributions. Yes, because I want to contribute.
There should be accountability for that.
We should have policies, we should have monitoring and evaluation to make sure that each coin
is accounted for.
It is true. It is true.
I think that's actually a very important point you're bringing up. You know, one of my biggest challenges with COVID-19 and the contributions that were being made by individuals, private sector, and everyone was that these contributions in many situations were being given in the context of a state of emergencies, where a lot of due diligence, good governance, democratic processes were suspended. And this is why after that, it was a huge mess for many countries to say, we want accountability. Those tenders that were given out for PPE, masks, and all of that, the money, where is it? You know, so I think that aspect of accountability is very, very important, lest we start saying that people are not actively participate or contributing towards the human and social development outcomes in a country. But it's important to talk about governance and accountability as well.
Indeed.
And
please.
And I also think that the government should make healthcare workers conditions of service attractive.
Yes.
To stop, you know, these, you know, flight of, you know, how to call it,
brain drain.
Brain drain. Because many of our doctors, pharmacists, nurses are relocating.
Absolutely.
At such a speed that it makes the whole point of we developing ourselves to take care of ourselves.
Yes. As we wrap up, I want to ask a question, because I also want us to be fair, because I know many of the episodes we are usually talking about what government needs to do, the parastatal private sector, the community. And I just want to ask a question. Who holds the service providers accountable? Because when we're talking about access to healthcare services, there's also the giver of those services on the other end, who also has a certain responsibility and obligation to ensure comfortable access to those services. So who holds those people accountable?
Yeah, that's a very good question. So in terms of our healthcare providers, who's holding them accountable? For them to even see a patient, touch a patient, they need to be licensed. And for you to get that license, you must have passed several exams, and not just the main exam, maybe after the university. Each year, you have to do some medical education, where you count how many points, and these points lead up to you as you renew your license. So you're constantly being educated, you're constantly being evaluated, and then you're constantly renewing your license. And as you renew your license, your certificates are checked. Are you competent enough? Are you being taken to court every other day by a patient because you mishandled them? So again, we have those checks and balances. I would like to improve those checks and balances. And I know I may get into trouble in this, but for example, in my country, the people who do those checks and balances are medical doctors. They check on each other. Okay, that's fine, but I'd like to have a mixture on that table, so that
more credible oversight.
Yes, because right now what we feel is that maybe they're protecting each other.
The industry, they're protecting the sector.
So as we know these checks and balances, we are checking the government, but also we need to check ourselves, who's checking us, but also there's that spirit of Ubuntuism. I don't want bad for my neighbor. I don't want bad for my child or the mother next door. I want her to thrive. So I'll do my best of my ability so that she can thrive. So
absolutely. I think checks and balances. Checks and balances are absolutely important, Dr. Marian, because the truth is that a lot of the services that we access in Africa are largely influenced by our culture, our religion. And we know, especially for women and young people, they still face a lot of barriers in terms of attitudes of service providers in accessing some of these services. So I think that's just one of the things that we need to really talk about, that, it's mutual accountability. All of us must hold each other accountable for ensuring that we create a safe space for accessing healthcare services. You wanted to chip in?
So regulatory bodies, to regulate every sector of these, because there's quackery in pharmaceutical practice. People just arrogate to themselves. Doctors, people who are not doctors, they take upon themselves, as doctors. I've never been to any medical school and hold any license. So who actually checks them? So that is what it says.
That's true. Isn't it interesting that nowadays you see stories in front of courts of law on social media about specialist doctors who actually didn't go to medical school. I was really shocked. I think even this morning I was seeing a story about a gynecologist or somebody claiming to be a gynecologist.
We have an ongoing case in Kenya about
I think I was seeing it actually in the Kenyan media. Yes, it's actually really, really scary. So I think as much as we're talking about creating a healthy environment,
we also need to put this.
We also need to hold them accountable.
But financial accountability is a problem with Africans. And what do you do? What do we do in this area? Request it. Request it to see periodic. Don't wait until, at the end of the year, at the 5 years. No, periodically. And if you have independent audit, who come and do their job, I think it will build confidence and help people understand that indeed what we are contributing is doing what we give.
Absolutely. I think the conclusion of our discussion is that a major driver or enabler of access to healthcare services for all is just, normalizing a culture of holding each other accountable, all the stakeholders from the community level all the way up to the service providers. So thank you very much for that. I really hope that at home this has been a very insightful and thought-provoking episode for you. But before we wrap up the show, I want us to take a look at our African health champion for this episode.
Christian Achaleke, a true Africa health champion from Cameroon, emerged as a beacon of hope and inspiration during the COVID-19 pandemic. Recognizing the need for accurate information and essential resources, he produced hand sanitizers for the masses while following WHO guidelines. Beyond that, he empowered communities by sharing knowledge on hygiene and dispelling misinformation. His legacy reminds us of the power of youth leadership and collective action in times of crisis, thus making him our Africa Health Champion for our episode.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @Africa Health Check. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.